Not all people who are dying and suffering from overdoses are people that have substance use disorder.
There are massive gaps in BC addictions help. That's according to Provincial Health Officer Dr. Bonnie Henry, who spoke to the Select Standing Committee on Health Monday, just weeks after BC marked 6 years of an opioid crisis.
Opioids, we have a natural part of our brain where they attach to, and when substances are used frequently and regularly, the brain circuits, including these reward systems, adapt over time. And the brain comes to think that that substance are essential for our survival.
Dr. Henry was joined by Dr. Nell Wyman of the First Nations Health Authority to speak with MLAs about the main issues they've encountered while trying to tackle the toxic drug crisis. Dr. Wyman says a major issue is that they continue to see Indigenous people disproportionately affected.
In 2021, the number of First Nations people who died from toxic drug poisonings rose by a shocking almost 26%. A total of 334 First Nations people died from toxic drugs last year, up from 266 people in 2020 and 116 people in 2019.
Both doctors point to systemic racism as a substantial issue that prevents Indigenous people in BC from seeking help.
Indigenous people face so much racism and discrimination and stereotypes, particularly about substance use, that they're driven away from any kind of supports, whether those supports are getting access to safe supply or getting access to drug checking or getting health care related to either substance use issues or other health issues.
UBC School of Nursing's Colleen Varco says there are a number of things that need to change, one being decriminalization, and the others?
Non-judgmental, compassionate services and care, recognizing the impact of colonization, racism, dehumanization on people, so that they aren't anticipating that every time they come into contact with law enforcement or healthcare providers or social workers, that they're going to be judged and discriminated against.
Both Wyman and Henry say family doctors need additional training in addictions so they can help effectively. Since toxic drugs were named a public health emergency 6 years ago, more than 9,400 British Columbians have died. Ashley Burr, City News.